Today, a second American missionary infected with the Ebola virus arrived in the United States from West Africa to continue treatment. The other patient, Dr. Kent Brantley, is said to be improving. Almost 900 people have died in West Africa in the largest Ebola outbreak ever. Dr. Jon LaPook is in Atlanta.
Nancy Writebol was taken to Emory University Hospital with the same high-level transport as Dr. Kent Brantley. Unlike Brantley, who was able to walk into the facility, she was wheeled in on a gurney.
Nancy has arrived safely.
Bruce Johnson, the president of the SIM charity group that Writebol works with, also read a statement from her husband David on her improving condition.
A week ago, he said, we were thinking about a possible funeral arrangements. Yet we kept our faith. Now we have a real reason to be hopeful.
Each of us will take a copy and do with our sections.
The CDC Emergency Operations Center is fielding calls from state health officials about identifying possible cases of Ebola.
And one of the key important questions is, have you traveled recently?
Dr. Hannah Atallah, Chief of Emergency Medicine at Grady Memorial Hospital, took us through the protocol for evaluating a patient with suspected Ebola.
Let's say I say I've been to Africa.
So the first thing that she'll do is she'll put a mask on you, and then she will take you immediately to one of our isolation rooms.
At Grady, the isolation rooms are in the blue zone.
We would just basically bring the patient right in here, make sure the door is closed, and make sure that everyone is aware that this is an isolation room and that you are an isolation patient.
So once you are suspicious that I might have Ebola or some other infectious disease like that, nobody is ever touching me without having any
personal protective equipment, correct. It becomes a system-wide response to make sure that we keep ourselves safe and then take the very best care of the patients.
The CDC has tested about 6 specimens from possible Ebola cases, and so far all are negative. The number of false alarms has been increasing daily, and Scott, the CDC says that's actually a good thing because a high level of suspicion will be key to diagnosing the infection early should a traveler bring it into the United States.
And there's no vaccine for the virus, but many are under development. Dr. Jon LaPook in Atlanta. Thank you, John.